Hello, we're your dream team, and these are our suite of interventions to tackle vaccine hesitancy.
Our first intervention involves a COVAX chatbot, which can be utilized on multiple social platforms worldwide for people to have an all-in-one resource to receive accurate and up-to-date information about COVID-19 vaccines. Users can simply ask questions to an artificial intelligent chatbot, which the chatbot can answer. In Japan, there was a 21% increase in the intention to receive COVID-19 vaccines after interacting with a chatbot. And in France, there was a 37% increase in participants holding positive attitudes towards vaccines, even with just 5 to 15 minutes of interaction with a chatbot. A SWOT analysis shows that obviously a chatbot would be a readily available source of up-to-date and accurate vaccine information. It utilizes artificial intelligent technology. A threat is there are other sources apart from a chatbot which people can utilize. And there are going to be questions a chatbot may not be able to answer, which is why we need to harness the efforts of healthcare professionals, which my colleagues will talk about.
According to US National Health Survey, 1/3 of the population are hesitant to be vaccinated because they believe that COVID-19 vaccine is unsafe. These populations are composed mainly of the less educated and the rural population. A significant percentage of these populations are less likely to understand and trust scientific information and more likely to believe in vaccination myths. For example, getting the vaccine is going to control people's locations. Studies show that for reliable information about a COVID-19 vaccine, 85% of people trust information provided by their own doctor. Therefore, Q&A sessions with healthcare professionals is an incentive that will significantly reduce vaccine hesitancy.
According to our SWOT analysis, the strengths involve direct conversation between rural communities and healthcare professionals will help reduce the conspiracies and increase the perception of safe vaccine uptake. The opportunities improves the health literacy of rural communities and obsolete misinformed data about COVID-19. The weaknesses in this area, individuals with religious restrictions might have secondary repercussions. The threats involve the availability of medical professionals to be able to go to each and every rural community. However, this can be overcome by having medical students perform the task instead.
Throughout the COVID-19 pandemic, analysis of Twitter has found that almost 25% of COVID-19 related tweets contain misinformation. This is a detrimental impact on vaccine hesitancy and acts as a barrier to herd immunity. To combat this, research has shown that flagging misinformation negatively affects participants' perceptions of these unreliable tweets and decreases their spread across Twitter. During a period around the 2020 US presidential election, Twitter labeled 300,000 tweets as containing misinformation. A subset of 456 tweets were flagged and locked to limit user engagement. Analysis of this subset found that tweets with misinformation flag experienced a 29% decrease in user quote retweets. In addition, we can also use fact checkers to combat misinformation. It's been found that seeing a fact checking label directly below misinformation can make viewers more favorable to vaccines. Furthermore, including a fact check label from research universities which are deemed as having expertise can be effective in reducing misinformation's negative effects. This is backed up by an experiment by YouGov at Cambridge University, where it was found that public trust in academics is 64% compared to 20% in journalists and politicians.
So our fourth intervention involves provision of incentives. Behavioral and health economics research by Kamenakis and Gilles' research group has shown that incentives are effective in steering human behavior. A US study showed that people are more likely to get vaccines if there are monetary incentives, regardless of incentive size. Here are some incentives to consider. They include holding lottery cash drawings or relaxing social distancing requirements, etc. SWOT analysis. Regarding strengths, incentives encourage more people to get vaccinated and consequently reduces vaccination stigma. And regarding weaknesses, incentives are not suited for the long run due to costs. Luckily, vaccination is a short one-time action. Regarding opportunities, incentives can be used in other short one-time actions like getting cancer screening. Regarding threats, in regions with widespread distrust, incentive payments might stoke new fears. COVID-19 vaccination incentives therefore might be used alongside other interventions involving reliable sources.
Our final intervention involves facilitating open dialogue with former anti-vaxxers to share their experiences about how they became pro-vax. Our SWOT analysis showed that anecdotes from former anti-vaxxers can be a persuasive and effective way to communicate vaccine information. However, anecdotes may not be taken seriously, which is why it needs to be delivered in conjunction with scientific research, and it can provide opportunities for qualitative research, social media campaigns, and media campaigns. Thank you.